All right, I love seeing the good mornings. Welcome everyone. We are so glad to have you. So, my name is JC, and I have the honor of representing the South Carolina Schools Network with Wholespire. Our mission is to identify and promote healthy eating and active living strategies in South Carolina public schools that empower key stakeholders and encourage collaboration among those seeking to improve student health and academic achievement.
Thank you, JC, for kicking us off this morning, as you always do. So, my name is Erica Ayers. I'm the school wellness consultant with the Nutrition, Physical Activity, and Obesity Prevention section at the Department of Public Health. And I also serve as the executive director for the South Carolina Governor's Council on Physical Fitness. Similar to the schools network, the mission of the Governor's Council is to promote the health of South Carolinians through the advancement of physical activity. And for several years now, the schools network and the Governor's Council have been working together in collaboration. And an example of that collaboration has been this webinar series. If you're new here, the purpose in our webinar series is to enhance collaboration between schools and communities using the whole school, whole community, whole child model as a framework to support student health as well as their academic success. So for today's webinar, we're going to be focusing a little bit more on the health services side, not specifically health services offered in the school setting, but more so how schools can partner with those who provide health services in their community. So Doxa would be a perfect example of that.
And thank you, Erica, for leading and facilitating this webinar series. Today, we are excited to learn from Dr. Head about why healthcare professionals are an important part of improving the culture of wellness in schools and how to engage with local healthcare professionals. Dr. Head is the Associate Medical Director for the MUSC Boeing Center for Children's Wellness and a faculty member in internal medicine and pediatrics at MUSC. She has a master's degree in public health and is additionally board certified in lifestyle medicine. She is a national leader in nutrition and food as medicine and works to bring disease preventing policies and practices into the school and clinical spaces. Welcome. We will turn it over to you. We are so glad you're here.
Thank you to you both. I'm very excited to be here, and thanks for everyone for joining today. I know it's spring break in the Low Country and some other areas around the state, so I really appreciate everyone being here in person, and hopefully this recording will be helpful to those who were not able to join us today. I'm going to go ahead and share my screen. I'll just have a shout out from everyone here. Let me know if you can see that slide there on the screen properly.
Yes. Thank you.
Okay, perfect. All right, so like we said, we're going to talk about school and clinical linkages through Docs which is one of the programs that we help facilitate here at the Medical University of South Carolina. But beyond that, we'll discuss how we can help connect healthcare providers and schools in the community wherever you live throughout the state. So our objectives for today, we're going to describe the impact of school policies and organizational systems on the wellness of children, and then hope to understand why healthcare professionals are an important part of improving school culture of wellness. And then together we'll list practical examples of healthy programs and advocacy initiatives that healthcare professionals can lead in schools. And then we'll all brainstorm ways to connect local schools and healthcare professionals where we live throughout the state. It's important to understand that health happens in the community. As a physician myself, a healthcare provider, I realize that the work that I do in the clinic only accounts for about 10 to 20% of modifiable contributors to health outcomes in the population. So when I give a patient a prescription or I give them advice in that clinical space, in the clinic walls, that really only affects 10 to 20% of their health outcomes down the line. And so we see here on the chart, there's a lot of other things that affect their future and their future health. When we talk about children and individuals in the community in general, there's a lot of other things that go into health outcomes. The physical environment is about 10%, social and economic factors, another 40%, and then health behaviors. And the education we receive around health behaviors is another 30%. All of those things go into quality of life and length of life. And so in children, we understand that the school environment contributes to so many of those things. And it's those policies and programs that we put in place that are going to go into creating better quality of life and longer length of life. And we'll talk a little bit more about that. We also understand that social determinants or social drivers of health are really what make a difference in our community. And education access and quality is a really big piece of that. And then healthcare access and quality is a big part of that as well. And bringing those two things together, having a relationship between our healthcare providers and our healthcare professionals, and then those who are experts in education, our school staff, our educators. It's such a really big piece of the puzzle to kind of bring everyone together within that context of community. This is the public health triangle and different levels of prevention that we have in health. And a lot of times when we think of medicine or healthcare, we think of those things that are more towards the top of the pyramid. We've got that secondary and tertiary levels. These are things where we start to diagnose clinical disease and really intervene. So you're thinking about all of those things where we go into surgery. Maybe somebody's already had a heart attack. Maybe somebody needs medicine because they have high cholesterol. What we're talking about when we talk about doing those policy systems and environmental change actions in the schools and linking healthcare professionals into the school community, we're talking about the base of the pyramid. It's called primordial prevention, and it's not something we talk about a lot. But what we want to do is maintain optimal health, maintain health, and avoid risk of even getting disease. And so what we can do is put in those optimal health environments so that people can maintain an appropriate weight or an appropriate blood pressure. They can have good blood glucose. They can eat well. They can have a space where they can exercise, avoid things like smoking. And so when we can link healthcare providers to the school space to make it a more healthy environment and join with teachers, join with school staff to be on the same mission, that's where primordial prevention can happen in the community. Health and education are interrelated, and I think a lot of us here know that, and that's why we're here. But we know that compared to individuals with a high school diploma, those who do not achieve a high school diploma are more likely to self-report poor overall health when they get older. They suffer from at least one chronic disease if they don't have a high school diploma, like diabetes, hypertension, heart disease. They suffer more premature death. They're more likely to earn a lower weekly salary or lifelong income, and unfortunately experience decreased access to housing, food, and healthcare. And so when we put in place things to improve our school environment and improve learning, we can help children achieve those high school diplomas and live longer lives. And so that's why healthcare providers are so invested in being part of the school system and being part of building up that healthcare and learning environment. There's also a bidirectional relationship between education and health, like I was just talking about. College graduates can expect to live at least 5 years longer than those who have not graduated college. And an additional 4 years of education reduces a range of health risks like diabetes, heart disease, overweight, smoking. And so really that relationship between the educational system and the healthcare system is a no-brainer. But there's a lot of healthcare professional coalitions and organizations that really call healthcare providers to action to be part of the school community. And back in 2005, the American Medical Association made a declaration of professional responsibility and said that medicine has a social contract with humanity and that we should advocate for social, economical, educational, and political changes that contribute to human well-being. And so you see that educational portion there. The Institute of Medicine put out a report back in the late 2000s, early 2010s called Preventing Childhood Obesity. And what they asked is that pediatricians should engage in the prevention of childhood obesity and take on roles in local schools and communities to do so. And they followed up with this accelerating progress in obesity prevention and said that they should actually get involved in community and state level strategies that help to do so. And the American Academy of Pediatrics actually posted a position paper that said that pediatricians should join school wellness committees. There are position papers from multiple healthcare provider associations, including physical therapy associations, nursing associations, that say that healthcare providers should have active roles in the school communities that look just like this, and not only in the subject of obesity, diabetes, but also in mental health. The Surgeon General in the last few years put out a large paper about the crisis in pediatric mental health and said we need more healthcare providers to partner with schools so that we can teach children more about positive social emotional wellness. It's really needed to get healthcare providers to partner with schools for these issues. And so, like we said, we're all here to focus on the whole school, whole community, whole child model. And as you see, there's 10 different core elements to this, but it's really surrounded by the community. And healthcare providers are part of that community to really participate in coordinating policy, processes, and practices within the school that support healthy, safe, and engaged, challenge supported students to improve learning and improve health outcomes for the students. So why do we focus on school-based wellness interventions as healthcare providers? And we'll talk a little bit about specific actions that healthcare providers can do in a school and how, if you work in a school, you can partner with healthcare providers. Well, school-based wellness interventions have a broad reach. So myself, as a healthcare provider, I can only see one patient every 15 to 20 minutes at max. A lot of times it takes more than 20 minutes, if I'm in the clinic. But if I go and volunteer at a school and I am able to teach a nutrition lesson or participate in a physical activity intervention, I can reach a lot more children at risk in one intervention. So there's a broad reach. There's, more than 50 million US children who attend public school, K through 12. It's a very diverse population, and it helps to address barriers to access, particularly in underserved areas. There's also really high yield points for intervention in the schools. We know that children consume a large portion of their daily food intake, and they do there's an opportunity for exercise expenditure at school. They're supposed to expend greater than 50% of their energy, so their physical activity during the hours of school. And it's a larger scope than clinical practice. Healthcare providers can act at a policy, systems, and environmental level when partnering with the schools, and they can help shape social norms in the community there at the school, which is really important for children as they're growing up to help learn what a healthy environment looks like. So how can a school partner with healthcare providers to put these recommendations into action? This is an example of what we do at Medical University of South Carolina at the Boeing Center for Children's Wellness. We do base our model on the whole school, whole community, whole child model. But our mission is to support schools in the adoption of proven strategies that promote optimal health and well-being for all. And our vision is a South Carolina where all children are healthy, succeed in school, and thrive in life. We do several things to support schools in implementing evidence-based policy, systems, and environmental strategies that build and sustain a culture of wellness to impact the whole school and community. But we do this through several initiatives, and I'm only really going to focus on number 1 and number 4 on the slide here. We have a universal school-based wellness initiative, which we'll talk about on the next slide. We also help to support schools in implementation of local wellness policy with technical assistance. We have a model that helps schools dive deeper in a school-centered wellness prevention and treatment model around behavioral health and diabetes prevention. We also have our Docs Adopt initiative, which is getting healthcare professionals paired with schools. So we'll dive deeper into that. Then we also work in behavioral health with these two projects, the ECHO project and Handle with Care. I'm not going to dive into those, but that's just a little bit about who we are. So our school-based wellness initiative, a very broad view. I'm not going to spend a lot of time on this, but essentially we allow schools to earn wellness awards. And essentially, in order to participate in our school-based wellness initiative, our schools need to form and maintain a school wellness committee with at least 3 members. They earn extra points, it's a points-based system, to add individuals to these wellness committees. And wellness committees can have a number of individuals from the community, but some of these members can be healthcare providers. It can include a physician, a nurse, a physician's assistant, any healthcare provider that you can think of, and they earn extra points when they include individuals like this. Other wellness committee members include parents, students, local businesses, so anyone from the community that might be really invested in improving students' health. And these committees meet at least 4 times a year. Some of them meet more often to discuss their goals and aims of wellness for the school. And what they do is we have a school wellness checklist that works on these specific categories. There are 7. And within this, we have a menu of choices. They're evidence-based policy, systems, and environmental change action items that the school can do and implement to earn points. This is a little example of our school wellness checklist. On this school wellness checklist, we have a lot of options. We have over 150 action items on the school wellness checklist, but this is just a sample. But according to the school's needs, they implement these action items and they get points throughout the year. And the schools essentially compete as a district to earn the highest number of points. All schools that obtain a certain number of points at the end of the year earn a wellness award, which is monetary, and they can put that amount of money back towards their wellness initiative. The school that earns the highest number of points gets a grand prize. And so they really like to compete against each other to have the highest number of points. But our categories are getting started, which is forming the wellness committee. We have a nutrition category. One of the examples of that would be to maybe maintain a food-based garden that the kids can go in and maybe not only maintain the garden, but have math or science lessons within the garden that include nutrition. Physical activity, including action-based learning in the classroom. Social emotional wellness is also stress management. That's what we used to call it, but we're going towards social emotional wellness now. So designating a calming or relaxation space for students, maybe integrating a curriculum. Wellness culture. This could be, an example could be create and support a student-led wellness committee. And then staff wellness, we not only focus on the kids, but we focus on the staff as well. Staff health screenings, having a walking group for staff. And then sustainability, we want to make sure the school has opportunities perhaps to connect with other organizations that might provide them grants or partnerships in the community. So a very small sampling there. So what is the Docs Adopt initiative through MUSC? Well, we partner healthcare professionals with local schools to serve on the school wellness committee. And this just offers healthcare providers and physicians a structured opportunity to provide support and knowledge and motivation to the schools as they implement evidence-based strategies and promote a culture of wellness. And there's no clinical responsibilities or services rendered as a part of this initiative. It's merely just sitting at the table with the schools, partnering, seeing what the needs might be, and offering support. And like I said, schools earn points for allowing or partnering with this healthcare professional to have them at the table and participate. The Boeing Center for Children's Wellness and our school-based wellness initiative is now in 20 school districts, and we serve 271 schools. We currently have 97 adopting healthcare professionals at the table with schools. Healthcare providers' role in supporting changes at schools can take many forms. So they can connect schools, they can be a connector. So identifying communities' resources and providers to increase support for an issue, whatever issue that may be. Maybe schools would like to include more fruits and vegetables on the line, on the cafeteria line at school. Perhaps this healthcare provider has a connection to local growers or local suppliers, and they want to connect those two. Advocate. A healthcare provider can advocate for specific change, decision, or policy. That can be as small as something like helping to build a new policy within the school. Maybe it's an anti-bullying policy, and the administrators need help with the verbiage, or maybe they just don't have time to look to see what the standard is in the area. Maybe the healthcare provider can help to write it and bring it to the table. Amplifier. Writes, speaks, or is invited to talk about an issue. Maybe the staff would love to have a nutrition lesson or a yoga lesson taught, but they just don't have the time to work it in. Maybe they want to come and talk about that. Team expert joins and collaborates to provide a subject matter. Almost the same thing, but maybe you're really passionate about something where there's a gap at the school and you can come in and be that subject matter expert. And then leader identifies or produces resources or establishes partnerships. This is where healthcare providers can really come in and identify gaps and kind of lead a mission if they feel like something could be changed for the good of the students. These are just some pictures from recent past. In the top left, we have a wellness committee who's making a plan and reviewing the year. This is a great place for healthcare providers to join schools in their mission to make the school a healthier place. On the bottom left, I have a picture of Dr. Janice Key and some other healthcare providers who have joined a school wellness committee, and they're standing outside of a school with a Docs Adopt sign. And just a really great example of how a small bit of volunteer time can change the culture of a school. On the right-hand side, top right, myself and dietitian Carrie Hollofield, we went to the state capitol in Columbia, to advocate for CEP, community eligibility provisions, and hopefully keeping everything the same to allow more students to receive no-cost healthy school meals. And myself, I went to National Advocacy Day in Washington, D.C. To advocate for several food as medicine issues. So really taking on that advocate role. So several different examples of how healthcare providers can play those roles that we just talked about. So these are some ways that healthcare providers can serve in the various areas of health and wellness in the school, and how schools can, if you find a healthcare provider in your local area that would like to be involved, how you can bring them in to your inner circle and allow them to participate. So in the nutrition area, perhaps they'd like to advocate for healthy snacks and help you with some healthy fundraisers, drafting a parent letter or meeting with the principal to discuss ways that you could make the environment more healthy, giving educational presentations for the PTA, or for the school staff if that's something you want to learn. Water drinking campaigns are huge. Maybe they have ways that they could advocate for water drinking by connecting school with access to water bottles, refillable fountains, or water coolers, and provide information on the benefits of drinking water to the kids. Maybe the healthcare provider wants to teach students about healthy eating or cooking by connecting the school with someone who does it really well, like a local chef or a farmer or a dietitian, or maybe they want to do a demonstration themselves. These are some examples of some things that have gone on around the state. On the left-hand side, we've got Harvest of the Month in a couple of different districts. This is where a healthcare provider has come in and assisted the district in getting some local produce on the cafeteria line and really getting the kids excited about what is that produce? How does it benefit the child's body? Why is it good for health? This is something really great that healthcare providers are good at doing, is just getting people excited about why healthy food is beneficial for the body. Top right is myself. They're in a teaching kitchen with some kids in Florence One School District, teaching some kids, doing a little cooking demonstration, teaching them about, I think that day it was kiwi and pineapple in a little dish there. And bottom right is some pediatric residents. They were teaching about hypertension, high blood pressure, and different ways that you can eat to help reduce blood pressure. And then in the center, you'll see a little water drinking campaign teaching kids how important it is to drink water right next to the water fountain. And so really bringing healthcare providers in to get good ideas about teaching nutrition. Physical activity is a really great space to get healthcare providers involved. They could partner with school staff to incorporate more physical activity in the classroom, maybe provide resources and trainings, or they could help provide resources for kinesthetic and action-based learning equipment if that's something that your school desires. Maybe they could join your school's team of students and staff in a community walk, run, or sporting event. They could connect this school with local organizations or resources to provide non-competitive physical activity opportunities before or after school for students. Maybe that's separate from their phys ed opportunity during the school day. Here are a couple of examples that we've had. We've got some pediatricians here in the bottom left that are tabling during a physical activity event. And we've got a walk and roll to school with us. That's a great opportunity for healthcare providers to get involved with, either to help organize or just to be present during the event. Healthcare providers can also, help to lead morning stretches, afternoon stretches, or after school stretches as well. Social emotional wellness and stress management is a huge area of need in our schools recently. And so this is an area where healthcare providers could present or invite a community partner to present a topic to staff. I mean, students are not just a need. Staff may need something for stress management. Present to students or parents on a social emotional wellness topic. I think parents are in great need of how to respond to a child if they have anxiety or depression. Healthcare providers could connect the school with resources to support substance misuse prevention program. These programs are present in quite a number of high schools, and it's a great way for healthcare providers to volunteer or support. And then advocate for the implementation of school-wide evidence-based and comprehensive social emotional learning programs for students. Does the school have outlets for kids, and is it present in every single grade? Or is there a way for the school to expand something like that? And then participate in social emotional learning lessons in the classrooms. Is there something that they could contribute as an expert? Top left here, we have Dr. Janice Key, and also Erin Schurter, who is a school psychologist, and an Ed.D. So Janice Key is bottom center, and then just to her right is Erin Schurter, but they are on the advisory board for our sensory garden team. And so that is a great way for them to be involved in basically a resource for children that not only combines gardens, which is a fantastic space, but a sensory garden, which is a resource for social emotional learning and a way to connect feelings with something that is tactile. Top right is an event called Screenagers. And if you live in Charleston County School District, you may have attended one of these fantastic events. But several of the physicians at Medical University of South Carolina, as well as some psychologists, have attended this event. This particular documentary was created by a pediatrician who realized that a lot of her patients were coming in with anxiety and depression. And when she really got down to the bottom of it, she realized that the anxiety and depression was being made worse by social media and the use of phones and their social media apps. And so she went out and she created a documentary. She paired with some of the leaders in neuroscience and addiction science and created a documentary that essentially highlighted the dangers of social media and how we need to talk to our kids about social media and how to use it positively. And so this documentary has been shown in Charleston County School District. And as you can see, many students, families, teachers, and healthcare providers showed up to this event. And healthcare providers sat on a panel and answered questions to teens and families. And it was a fantastic event. There was a lot of questions about social media, family time, alternative activities that could be done besides scrolling and going on social media. And then the other things that came up was addiction. And so it was a really great space and time to pair those healthcare providers with families there and the school. It's been shown at various of these documentaries have been shown at middle schools and high schools within the district. And then bottom left there is some of our pediatricians who addressed some of our teenagers, preteens actually, about period poverty. And so really kind of some social emotional learning there, and then some also health issues. And so they were also able to bring the schools. I don't know if you can see those pink bags in the bottom left, but those were period packs for the kids as well. Wellness culture, so bringing more wellness culture into the school, healthcare providers could help draft school-level wellness policies and encourage the implementation of wellness policies by meeting with administration or hosting educational presentations with the PTA. Attend a health and wellness fair, attend a student-led wellness committee, or assist the school with creating content to include wellness communications for families. I think creating or helping the school create a newsletter, like a little column, a health-related column in the newsletter is always a really great idea. On the top left here, we have some internal medicine and pediatric physicians getting involved at a health fair. One of their tables was about high blood pressure and another one was about asthma. We've got a really great game going on at a health fair. There you can see a little spinner where people could win prizes. This particular table was about physical activity. You can see some jump ropes on the table there. And then bottom left, same thing. So lots of physicians participating in health fairs here over the last year. And then lastly, healthcare providers can create an evidence-based educational video on a topic within any category of health that could be shared by the school at any point in time. It doesn't have to be shared at a specific time. And I do have an example, but I'm curious to know if videos would be helpful in your school or in your area. Have you ever used them? Or, do you think videos are helpful in your school? Please feel free to share in the chat, because we're about to come to our little brainstorming activity. So if you would like to come off mute, please feel free. This is a screenshot of a video that two of our fantastic physicians at MUSC created for a school. For time's sake, I'm not going to share the video. But essentially, for their children's elementary school, they created a stress management video. And essentially, they walk the kids through what to do when they encounter a stressful situation and how their family deals with it. It's 3 to 4 minutes. And essentially, they take them through a little gratitude exercise and a little deep breathing exercise. These are two critical care physicians. And so I thought it was a really great idea and a really great example of how two parents of children from the school who are also healthcare providers could really pay it forward and teach the kids two tangible things that they could use when they feel overwhelmed. So gratitude and breathing. What a great example. And lastly, staff wellness. Healthcare providers can assist the staff as well. Assist in the development of wellness needs or interest survey for staff. Connect with organizations that can provide on-site health screenings. Connect with community partners that could do classes for staff like exercise classes or free massage, and then provide a wellness professional development opportunity. For example, if there's a lot of staff that are concerned about their blood sugar or their blood pressure, maybe a healthcare provider could come in and teach them a little bit about diabetes or high blood pressure. This is a staff wellness event that went on in Florence, one school district. In the picture here, kind of the bottom right on the left-hand side, you can see dietitian Carrie Hollifield and nurse Beth. Both of them are healthcare providers that have been really instrumental in running this particular staff wellness day, but this was a cook-off. And so two different schools, staff got together. It was almost like a chopped style competition. They had a basket of ingredients and they cooked off and had a competition, and it was a really successful event. But healthcare provider participation in this and leadership was absolutely essential. You can also see there were chefs there. So another really great community partner to have available. Healthcare providers can connect school with community partners and resources and help with grant writing and establish healthy fundraisers to raise money in the sustainability category. So I would really love to brainstorm. If anybody on the call would like to come off mute and just let me know, how can you connect local healthcare providers to your school or schools in your area if you don't work at a school? And are there any specific roles a healthcare provider could play at your school that you can think of? You can put it in the chat. Okay, nobody can come off mute, but they can use the chat. And I've got a bunch of examples on the next slide. So if you can't think of anything, that's okay. That's why I'm here to provide great examples. I'll give it another few seconds. Okay. So some really good ways to make school connections with healthcare providers. Ask the PTA or the PTO if there are any parents that are healthcare providers, and maybe they would like to volunteer as being a leader or an advocate. Maybe you can approach your local healthcare system. So where's your entry point? I mean, who do you go to in your local healthcare system? Well, you can go to the communications department or the community outreach department. A really great place to start is if you have a residency training program or a medical school. They love to get involved and they are fantastic experts in health. And so go to your graduate medical education office or the College of Medicine. And I think that would be a fantastic place to start. Or the College of Nursing or another health profession. Do you have a physical therapy school? Do you have an occupational therapy school? Those are great places to start. What about your local private practice? I know there's a really large private practice, a pediatric practice near us that does walk with a doc. I don't know if you know about that program, but they're a fantastic practice that has some really active pediatricians in our area. You could utilize your district relationship with a healthcare system. You know, do you have behavioral healthcare providers that come to your school? Does your district utilize telehealth? And then, you know, reach out to your county level medical organizations. I've got a picture coming up that shows just how active they can be. So I live in Charleston County, so we have the Charleston County Medical Society. Does your county have a medical society? Those medical providers tend to be really big advocates. It doesn't have to be the physician society. It could be the nurses society around you. Reach out to those county level societies. And then the various roles that healthcare providers can serve. If you have a school level wellness committee, they can be a member of that. If you don't, that's okay. If you have a district level coordinated school health advisory council, they can sit on that and help to advise your district on various wellness PSC changes. And then there's also a health advisory committee at the district level that's different than a CSHAC, but they could sit there. Health professionals can lead an after-school club in fitness or nutrition. What if they lead a professional development day for staff? They can help with health fairs, career days. They could help draft a school or district level nutrition, physical activity, or social emotional learning policy. So really, any one of these things would be a great place for a healthcare provider to come in and start getting active. This is a picture of the Charleston County Medical Society School Health Committee. This was in 2012, and these members actually won the Community Service Award from the South Carolina Medical Association. So South Carolina Medical Association is over the whole state, and they chose the Charleston County School Health Committee over all the other counties to get the service award because they were so invested in serving our schools that particular year. So it's just an example of a group of, this is not only physicians, we've got public health individuals. I don't know if anybody recognizes people in this particular picture, but Carolyn here, she now works for Clemson Extension. She's really active in our gardening program. So there's a lot of really great people in this picture in all various aspects of health. And so just a really great example of dedicated people who are dedicated to serving kids in schools. So to close it out, we do have access to what we call our health professionals resource guide that kind of goes back over everything I talked about today. You know, how can healthcare professionals assist schools to increase the wellness culture at schools? It is available on our website. So I will try to put this, I'll try to put this link in our chat. If I don't get the time to do that, you can go to the MUSC Boeing Center for Children's Wellness website, and it's right there. And if there's any questions, feel free to place them in the chat. But I thank you so much for allowing me to speak today. And I'm available for questions.
Thank you so much. That was really, really great information, and a lot of really great tools that are implementable this year and also can start those conversations for next school year. So we really appreciate you and all of the knowledge you've shared with us this morning. I have not seen any questions coming through the chat at this point, but I think Erica has some important wrap-up information for us. If y'all have any questions, please list them. And if we're unable to answer them now, we'll send them to Dr. Head for answering via email.
Yeah, thank you again, Dr. Head. I do have a question for you. Could you reiterate for the folks on the call? So we saw that because it is spring break, but we know folks are going to come back and watch the recording as they always do. Can you reiterate how, if you're in a school, what's that best first step in reaching out to get a doctor to serve on your school wellness committee? And then again, could you also reiterate if you work in a state agency or a community, how do you help make that connection?
Real
And
quick,
you're on mute, Dr. Head.
Of course, I'm on mute. So if you work in a school and you have a wellness committee, have your wellness lead reach out to the PTA or PTO and see if there's any parents that are on that committee that are healthcare providers that are interested in serving on your wellness committee. Because your PTA and your PTO are already volunteers. You already know that they are invested in volunteering. So maybe you can get a healthcare provider from the PTA or PTO to sit on the wellness committee. If you don't have a wellness committee at your school, typically your school nurse or your physical education teacher are the ones that have the finger on the pulse of the policy systems and environmental changes going on in the school. If you would like to get a healthcare professional from the community to start volunteering in your school, what I would do is, again, you can reach out to your PTA, PTO, but if you have a relationship with a local community practice, again, your behavioral health providers, your local private practices, reach out to them and see if there's anyone that would be willing to make a connection with your school. And then if you are a community partner, you don't work in the school and you're helping the schools make a connection with the healthcare providers. I think there's a couple different ways that you can do it. If you have an active social media presence and people are following you, then you could put a call out and say, hey, if you're a healthcare provider and you want to help schools improve their wellness culture, please let us know. And then you could help pair people. But otherwise, you can be that technical trainer to help assist the school in linking with the PTA and PTO. Or you could help go to the local medical university and reach out to communications or reach out to the community outreach department and see if they have a list of physicians who are looking to volunteer. I know at my university, there is a large group of physicians that are constantly looking to get involved with the community. And it's just a matter of identifying those opportunities. And so there's usually somebody at the university level that has a list of physicians that's looking to volunteer. So if you work in a community organization, getting in touch with those large medical universities and finding that list of healthcare providers that are looking to volunteer is a great idea.
That's really helpful. And that's a good reminder that there are folks, there are healthcare professionals who are out there who want to be involved, who want to help, who want to volunteer. You just have to reach out to make the connection. So that's really helpful. Thank you. Thank you, Dr. Head. JC, anything else popping up in the chat for the group?
No questions. Sharon Smoke was sharing that the MP in their community serve has graciously offered to serve on their wellness committee. So there's great connections throughout your area. It just never hurts to ask.
Thank you for sharing that with us, Sharon. And thank you again, Dr. Head. We just appreciate you taking the time to share this information with us. And again, just want to thank everyone who was able to participate in the live call. This will be promoted afterwards, the recording. So we do anticipate quite a bit of traffic to hop on to Wholespire's webpage afterwards. And then if Jay-Z hasn't already, I know she'll share the webpage on Wholespire where you can find all of our recordings from our past webinars. So with that, we do have one more webinar left for this school year's series. So for May 21st, so next month, it's going to be on how schools and communities can provide access for physical activity. So be sure to join us for that one. The flyer will be going out soon, but you can always register right now for that one. It's live on their link, so check it out. And then also we want to promote some of our partners' upcoming events. So we heard from a couple of months ago, Special Olympics South Carolina. They share that their summer educator workshop is coming up. This is a free workshop. It's Friday, June 20th. It will be in Columbia, so you can sign up for that one now. That's the QR code to access that registration information. And then in addition, we also heard from our partners from SCAFER, the South Carolina Alliance for Health, Physical Education, Recreation, and Dance. Their annual conference is coming up in November in Myrtle Beach. And you can now go and submit your session abstract if you're interested in presenting at SCAFER this year. And they are providing this conference this year in collaboration with Special Olympics South Carolina. So it will be very focused on adapting and engaging all learners in South Carolina. So be sure to check that out as well. And with that, again, just thank y'all so much for having being part of today. And Dr. Head, thank you again. And JC, thank you. And Juanita for always helping to plan and coordinate these. Any final thoughts, questions, ideas, anybody?
Thank you all.
All right. Thank you. And we'll see y'all next month. Thanks, everybody. Bye.